Health Hats, the podcast.
I really like Susanna's definition of hacking. Usually we think of hacking as a criminal who's busting into our system and ransoming it. But I like to think about that hackers are the people who are the most dedicated users of systems. And they modify them for their workflow. They develop workarounds, they have novel uses of the systems, they want more. They identify cracks and flaws in the systems they use. Everybody hacks. The EHR was designed to be a billing system. It is really good at billing. They added regulatory because they had to. And then they shoehorned in clinical. And patients and caregivers are way down the list. So it is no wonder that you need to hack the EHR. It's a setup for hacking. So I've done all sorts of different hacking. The most simple one is with my son, there was no proxy logon. I used his login and password. With my mother, there was proxy, but it was a pain. And we ignored that and did it that way as well. I don't know about you, but I don't remember a doctor visit. Here I am, a nurse, and I've been in healthcare for 50 years, and I go home and I remember at best 25% of what happened, and so I record. I can share with my wife. The hack that I'm playing with now, of course, the shiny object right now is AI. And I keep, since I started with Dr. Kinkle, he was a neurologist, Rip Kinkle, how's that for a name? Rip Kinkle, he was a young curmudgeon. But anyway, when I started with him, I set up a spreadsheet to keep track of what's important to me. It includes the time I play music. It includes the steps I take every day. I try to get 3,500 steps a day in. I include falls, and I include my weight. And so I want to use Claude, and I want to create a graphics that I can take to the doctor or whatever clinician I'm going to, and I want it to help me with doctor speak. So far I've failed. I am not a good prompt. I'm still learning prompting, and perhaps I need a solver. But I know this guy who is a designer, and he has two kids with rare diseases. And one of the kids seems to get a new diagnosis every couple of years. And so he is working to collect all the clinical data he sees 12 different specialists, and collect all that information, the clinical record, the images, the lab work, and then there's all the information that he and his wife collect. And he's trying to figure out how to use large language models to prepare to go to the next specialist. So they're going to a cardiologist, and what does he need to bring, and what test results, and what history. It's a mountain of data. And I really hope he is successful on that.
I host, write, and produce Health Hats, the podcast, with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.